Well, new tonight, parents, a warning from the CDC about the parechovirus, which reportedly infects an infant's nervous system. It's already made a handful of babies sick. So News 12's Julio Avila spoke with a pediatrician and brings us more on what you need to know about this illness.
23 infants have been hospitalized after catching a virus called parechovirus. That's according to the Centers for Disease Control and Prevention. The agency says those babies were between 5 days to 3 months old. And according to Dr. Brenda Anosike, the virus is typically found in very young children around that age.
Where it becomes more of an issue is those children who are much more susceptible to really severe disease are the infants, particularly those less than 6 months of age and even more so less than 3 months of age.
Dr. Anosike is a pediatric infectious disease specialist at the Children's Hospital at Montefiore. She tells us that they have seen cases of parechovirus throughout New York City. However, she assures parents there's no need for alarm because this virus is considered mild.
It's not a new virus. It's something that is fairly common in young children.
Which means you could have already had it as a child and built up an immunity to it. In fact, you might have had some of the symptoms which are similar to a cold.
Typically, they may have fevers, pretty high-grade fevers. In other more rare situations, they actually may present with seizures or even some changes in their nervous systems.
Dr. Anosike says parechovirus can be spread through contaminated food and water, as well as through fecal matter. But as to why attention is being focused on parechovirus now,
they don't develop that immunity as we once saw before. And so now with the mandates are a little bit lax because we're eager to get back to normal life. Unfortunately, those viruses are still circulating. They never went away.
Right now, there is no vaccine for parechovirus, but she did say the chances of catching the virus can be mitigated.
Washing the hands appropriately before and after bathroom use. And really trying to maximize a clean environment as you would do routinely in your household as it is.
And she recommends talking with your child's doctor over potential concerns. Julio Avila, News 12.